There we go. And I should also, before Dr. Sedberry starts, I should also embarrass her and say, today is her birthday. And in addition to being Veterans Day, she still was nice enough to join us. And so Dr. Sedberry, you should have a beautiful flower delivery that either got to you already or is on its way to say thank you and happy birthday.
All right, so we're going to talk about surviving audits and winning audits. And so, sorry, my dog's not acting up. So I just went through an audit for use of some graphs on some patients. They were questioning about $110,000 between these the patients that they selected. So I'm going to go through and show you kind of what my experience was and some advice and kind of what got me to win the audits, so to speak. Okay, so prior to getting audited, this is probably the most important thing, is document well. Also, you want to document well, and then you also want to document well, because everything that's in your notes is going to be either used for you or against you. So if you don't mention that the patient, you talk to the patient about smoking cessation, if you don't talk about why you use certain modalities for certain treatments, or why you didn't use certain modalities for certain treatments, then they're going to question that. You also want to document everything that Medicare requires in order to perform that treatment. And of course, this is going to be based regionally, just like I mentioned earlier. For some regions, you can justify nail debridements just based on them having fungal nails versus other regions where you have to have pain or some other comorbidity to meet this. So this doesn't just apply towards grafts, but that's what my audit was about. So you'll probably see me focusing a little more on that. So first thing you're going to do, you're going to get a letter from for patient charts. This is going to be likely from a third party. Mine was from Ciox. Don't panic. So that's step one. Next step is to send the records. This will be a lot of records. I had someone in my office gather them. We included all of the papers stating that they received the graft, which is not necessary, but we had that also in addition to the notes, and then all of the documentation of what graft it was, on what days, what lot numbers, and all that. So it's a lot of information to send, but I would include everything possible that you can. Also, you want to send them certified mail so that you know that they received them and when they received them. And you also want to keep a copy of what you sent, because this will be useful to provide to lawyers or anyone else on your team, and also eventually the judge. So this audit, it will take months or years. I think mine took about 2 years to complete, and they went back to about 2 years prior to that initial chart review. So some of these patients I started seeing 4 years prior. And this is the time to use your coping skills. So if you haven't learned any of these coping skills, you will probably want to learn them fast, because you're using them over the next several months to years. Next, they will send you a paper saying that they want all their money back. At this point, you want to contact your malpractice to see if you have audit coverage. If so, the lawyer they appoint will contact you. There sends the first appeal. Either you'll send that your billing company or your lawyer. You just discuss that with them. And if you don't have this coverage, then you want to contact a lawyer as soon as you are notified of this audit, so you can get assistance and so that the communication is fluid. You're going to lose the appeal. Don't panic. Then you'll move on to the next level of appeals, and they'll start wanting you to repay the money back at this time. So here's your options. You can pay the money back. When you win, they'll send you the money back with interest. Or you can not pay the money back, and when you win, you still have the money in your account. But if you document is shitty and you have to pay the money back, then you have to pay it back with interest, which runs about 10%. So if this is happening over the course of a couple of years, that interest becomes a lot depending on how much money we're talking about. So preparing for the hearing, your lawyer will create several documents outlining every patient and every encounter in question. This will be thoroughly reviewed. They'll see what the error was, so they will discuss what the PsyOx or this third party is claiming was an error and why you should have to repay it. They'll discuss why this is incorrect. So maybe it was the verbiage that was used that they don't understand, or that they didn't know what the correct Medicare guidelines were for your region. Typically, what I found is that with most of the charts being reviewed, it's usually an error on their part in not understanding either the guidelines or the verbiage that's used. And then you should review these documents that the lawyer creates, and then in addition to reviewing every patient and encounter, so that you're prepared for any question that might be asked, both by your team and also by the judge or anybody else that is a part of this audit. And then you're prepare well for the hearing. So that just goes back to reviewing the documents, knowing your patients. For me, a lot of socioeconomics played a big role in the treatment of my patients. I live in an area where 55,000 people are in the city that I live in. However, 400,000 people come to the area for their medical care, and they're from very rural areas. So a lot of things like home health may not be available, particularly with COVID, where we had a extreme shortage of healthcare workers and home health people to provide things like wound vac changes and that sort of thing. So once again, know about each patient. So where are they from? Are they from a really small town where there's no nearby doctors, and you're the only one and they take 3 hours to get to and from your office? Did this happen during COVID when resources were limited? There may be like a graft shortage during that time, or only certain sizes available, or you may want to see the patient more often because there's nobody, no other wound care center in the area. And then what are their comorbidities? So do they smoke? Did you address this? Are they diabetic? Do they have peripheral vascular disease? Are they able to even ambulate? So this may play a role in getting to and from appointments. And then what's their home life like? Do they have someone at home to take care of them? Are they living on their own? Can they see their foot? Can they do dressing changes? And then definitely document that they are at risk of loss of limb or loss of life if they're not being treated properly, if it's such thing as like a wound or gangrene or something like that. And then discuss what the benefits of the service you provided to this patient. And then the audit will go to the hearing. You'll meet with the team if you haven't already. My team consisted of an attorney, a billing and coding expert, and then a professional witness. So in my case, it was a wound care expert and another podiatrist. Your lawyer will set up time for the hearing, and this will be over the phone with the judge. You're sent through mail what to do, what phone number to call, what codes to put in, and a little bit of what to expect. And this is nothing like judge duty. I went in thinking, oh, maybe, but no, it was definitely not an experience like that. So the hearing, a judge will be on the phone. Hopefully she's in a good mood. She'll direct everything and you'll know when to speak and what to talk about. So that was kind of what I was nervous about, was how the hearing was actually going to develop, especially being over the phone and not in person. The attorney will introduce everybody on the team. And then you'll introduce yourself, and kind of each team member will introduce themselves, what their experience is, what their training is. You know, if you have any publications on things, or I would also bring that into introducing yourself, whatever can make you look better. And then the team will go patient by patient and actually encounter for every patient, explaining why you followed all the rules. This will be very in-depth, and why you performed the services to each patient. So in my situation, they asked, like on one patient, well, why didn't I use a wound vac? I had actually attempted it, but there was no services available in his area, and using a wound vac would actually have been detrimental to his health. Or they'll ask you what technique or product that you use on each patient. I had a question of like size of the graft that was used. And at that time, it was the smallest size of the graft available. So that was kind of my defense on that situation. And everything will be based off your documentation. So once again, document everything very well and abide by the Medicare guidelines, and you'll be able to win the case. So after the hearing, the attorney will call you or text you and tell you did a good job. You'll wait weeks to hear back that you won. You'll continue with your coping skills during this week, because that's probably the time that you'll feel the most stressed. And then your attorney will know before you get your letter and will call you. Weeks later, you'll be seeing a large sum of money that hit your bank account if you had initially repaid the money. And, you know, like a boss.
Thank you, Dr. Sedberry.
Mhm.
And I have